I'm the chair of the Moving Forward Nursing Home Quality Coalition, and we're delighted that you've joined us today. I'm joined by Jennifer Baker, our director, and Emily Willard, our program manager. And we're here with a bunch of wonderful guest speakers and advisors to talk about strengthening nursing home leadership and QAPI, quality assurance, performance improvement, readiness in work that we've been doing over the last 2 years in the wonderful state of Michigan. So this work is applicable across our country, but we do want to highlight the great work that we've engaged with this wonderful Michigan team. So I will say that in addition to the Moving Forward Coalition, we're also joined by our colleagues at the Leading Age LTSS Center at UMass Boston. And you're going to hear from some of those folks as well. So I'm just going to introduce the speakers, and then I'm going to turn it over to the first speaker to walk us through the program. And we would love to encourage you to chat in your questions, your ideas. Jennifer and Emily and I'll monitor the chat, and we'll have some time for Q&A at the end. So our wonderful panel of speakers includes Nancy Swires, who's a registered nurse. She has more than 35 years of experience in long-term care. She's been a director of nursing, and she's had a really strong focus on practical leadership and QAPI implementation. I already introduced myself. Chrissy Horton is a nurse educator at Fontainebleau Nursing Home with Optalis Health, and she was one of the program champions in our work in Michigan. She's going to talk more about that. Michelle Macia has more than 40 years of experience improving care with older adults. She is a nurse practitioner, a DNP, and does work with emergency rooms and older adults and many other things. And then finally, Molly Wiley, who is our wonderful colleague from the LTSS Center. She leads research projects across long-term care services and supports and focuses on nursing home quality. She's also a gerontology PhD candidate at UMass Boston, so we're excited about that. So that's our group for today. And again, please chat in your name, where you're from, any questions you have. We'll continue to watch that. And I'm going to start us off by turning it over to Michelle Macia, who's going to talk about the state team and the grant opportunity. So Michelle, over to you.
Okay, great. Thank you so much, Alice. And thank you, everybody, for being on the call today. And a big shout out to Emily and Jennifer that helped put this all together, and Nancy for putting the slide deck. And I do whatever Alice wants me to do. Okay. So just letting everybody know. Yeah, it's really hard to say no to Alice. So let me talk to you about why Michigan. Who is this Michigan State team? So in November of 2022, it was an idea. Alice started speaking with people across the states and local communities about different ways of working together. And she really challenged us to think beyond the Moving Forward National Committee and ask what it would look like if a state-based and local teams work closely with the Moving Forward National Coalition to truly embed change where care is delivered. And she said, it's really about reframing the conversation about nursing homes. And many of us had worked in nursing homes. We had an idea about what's in nursing homes. And she said, you need to think about how are they today, how they could be, and the urgent need for the public to demand a better quality of life for both the residents and the staff who care for them. And she summed it up perfectly. I remember being on the call, and she said, write the play first, then build the stage. And I went, oh, okay. And she says, Michelle, I'd really like you to lead the Michigan State team. So it became a reality in 2023. And that was because of the generous support from the Michigan Health Endowment Fund. Through Alice's broad outreach, because we know Alice knows so many people, and coaching me, and you're going to hear a lot about coaching, coupled with my familiarity with my community as an APRN working in a level 1 GED, the team grew quickly. We went from 8 members to more than 40 today. And that's because other people were inviting other people. They started learning about what we do. And all these people, we have a really strong moral compass to improve nursing home care. What makes this team very special, though, is the diversity. We have so many voices across the system. We have a resident, and I heard Margarita's on the call, and she's a resident. And we have certified nurses assistants. We have an ombudsman. We have area agency on aging. We have the Michigan Elder Justice. We have Superior Health. We have Michigan Department of Health leaders. We have long-term care operations specialists. We have In Part Alliance, the Michigan State University School. We have schools of nursing, researchers, geriatricians, emergency preparedness and homeland security leaders, Leading Age, the Healthcare Association of Michigan, Pulp Med Michigan, hospice agencies. And boy, I hope I didn't forget anybody. But there's a lots of people. We're always having people join. So how does this team work, and what have we accomplished? Well, early on, we developed clear organizational structure. And we said we've got to meet bi-weekly because that's the only way we're going to keep the energy. And I was really thought, oh my goodness, people are going to say you're going to meet like twice a month. And we said, yeah, we have to. So what happened is that we started meeting twice a month. Smaller groups started to form organically around priority issues. One early focus was we looked at the nursing home workforce. And just as we were starting, the Michigan Nursing Home Workforce Stabilization Council published their report, which laid out the policy, the legislation, and administrative recommendations aimed at improving quality in nursing homes. It also released a report of certified nurses assistants and direct care workers, their perspectives in their own words. And it was really heartfelt. Okay. At the same time, the team worked to bring specificity to one of the National Coalition's goals around goals, preferences, and priorities. We conducted key informant interviews with nursing home staff to better understand how these GPPs were determined, and once determined, where did they actually live? Did everybody know about these, what the residents wanted? What also surfaced too is that end-of-life wishes are communicated, but how do they travel? How does everybody know? And despite good intentions, our colleagues who worked in nursing homes said there's barriers and confusion. And it's due to the two documents that we have in Michigan called the My Post, which is a physician order for sustaining treatment, which was signed in legislation in 2017, and the out-of-hospital DNR order. This confusion was especially present when there was transition from the hospital to the nursing home to the hospital. And we can't have that, right? Because we can't not have people's end-of-life wishes. So under the guidance of two of our members, Dr. Cheryl Huckins, and we also had a lawyer join us, Jennifer Martin from the U of M, we started looking at the documents, putting things together with some of the other members of the team, and started meeting with a legislator to rescind and replace with one comprehensive document called the MOST. We also learned from our members from Superior Health, because everybody was chatting in, we were saying, what people are doing. They were hosting successful virtual emergency preparedness programs for nursing home. And a team of us, because we had, as I mentioned, we had emergency management people on our call too. We said, hey, how about piloting an in-person exercise? And we did that. And we hosted a successful exercise with 7 nursing homes. And we met at one location. So where are we now?
Michelle, we need to move on.
I'm almost there. I timed myself, girlfriend.
Okay, go for it.
I timed myself. During all these initiatives, members were also volunteering their time as coaches in the Michigan Moving Forward project. And that's what we're here today. So I have to say, being part of this Michigan project, the Moving Forward project, really accelerated our work. We really saw how we all blossomed and bloomed being part of this. And with saying that, we're going to Nancy, because she's going to talk to you about this project.
Awesome. Thanks, Michelle. When we began Moving Forward Michigan, we overshot just a titch. One more. There we go. When we began Moving Forward Michigan, our goal was not simply to offer education. We wanted to strengthen leadership and QAPI capacity in a way that felt really practical and doable for the nursing homes, who were already so stretched serving high-need populations. And while QAPI is required under the CMS federal regulations, that wasn't our driver. Really meaningful improvement was. So our purpose was to build leadership skills across the roles, strengthen confidence and competence in QAPI, support real performance improvement projects that are meaningful to the nursing homes, and develop tools that could live beyond the life of the grant. So at the heart of this work was culture, and we adapted an all teach, all learn culture, which is why you see so many of us presenting today, because we all learned from each other. Next slide, Emily. Thank you. This was a multi-year initiative funded by the Michigan Health Endowment Fund. We partnered with 4 Michigan nursing homes who were identified by some different criterion. Our inclusion criteria included they needed to serve a high Medicaid population. They needed to be present in communities with a high social vulnerability index score and a CMS 5-star score of 3 stars or lower. So selection wasn't about choosing the highest performers. It was about readiness and commitment to engage deeply in this improvement work. We knew we were going to be working directly with them for 18 months. And so that was a key part of the inclusion were deep discussions about what it was going to take. So we needed to have buy-in from both the leadership of the nursing home, as well as the program champion and the team members. Next slide. Oh, I love these slides. Okay, through this, you're going to see slides of our teams and our people. This was our Rivergate Healthcare Center team. And at the conclusion of the project, each team got a certificate of excellence, and we really went out of our way to celebrate them. They did hard work for a long time and stayed dedicated to the program. All 4 nursing homes that started with us finished with us. So we really wanted to celebrate them. And so you will see their faces all the way through this presentation. Okay, next slide. All right, program description. We designed the program to be both practical and feasible. And we did it in collaboration with the nursing homes. Scheduling the education sessions needed to be at times that were easier for people to step away from care provision and other duties. Our goal was to have both direct care staff members as well as leadership members and multi-faceted departments attend. So the sessions were presented via Zoom, but they were recorded. So people in off shifts or people who were unable to get pulled away for a day were still able to participate. And we made the expectations really clear from the start. We had open and honest conversations about the commitment this would take because we didn't want anybody to get partway in and be surprised. We recognized that this had to fit within daily operations. Otherwise, it wasn't going to work and it wasn't going to last. Next slide. We intentionally integrated 3 components, and I think this was really the key. Leadership education, QAPI training, and coaching support. So we're going to talk about each of those initiatives. Leadership and QAPI, they weren't separate tracks. They were designed to reinforce one another, and then the coaching helped weave them all together. Each nursing home committed to having a multidisciplinary team participating. They identified a program champion and agreed to complete at least one performance improvement project based on their data and their priorities. And that was part of what made it real world because they chose what they were going to work on. We also provided a modest stipend, and that really mattered. It allowed the nursing homes to reinvest in programs and services that reinforced the learning. So if there were areas they wanted to hit a little harder, they could purchase some resources to help support that. Trying to look for questions. Somebody holler if you have a question. Otherwise, I won't see it. Next slide, Emily. This is our Fountain Blue team. Several members you will see speaking today. This was really fun. This is Michelle Mosia was the coach with Fountain Blue. Chrissy Horton was the program champion. You'll be hearing from her later. And the idea with this one was we gave everybody a magic wand, and it was just before we started the QAPI portion. And so everybody had their magic wand for our team meeting, and we said, if you had a magic wand, what is one thing you would change? And so it really started thinking about the the purpose of QAPI. What should we change? What do we need to look at? I saw the question, how much was the stipend? The stipend was $13,500. Alice will correct me if I'm wrong. I think
That's
I'm right.
correct. That's correct.
Yes. Okay, so we wanted to make it fun. We didn't want this to feel burdensome. We wanted it to be something that people said, "Oh, I get to join my team today for the call." So we did a lot of little things like the magic wands. Okay, next slide. Our program team was so vast and varied, and we were so lucky to have the skills and talents we had. We had Alice, our fearless leader, who helped us make sure we were moving in the right direction. I was kind of the boots on the ground Michigan coordinator. I'm the one that everybody got emails and phone calls from all the time, and they were so gracious and kept taking them. We had national experts and education faculty. We got to work with Marie Baltz, Joanne Reifsnyder, Aaron O'Brien, our QIO partners from Superior Health. We just had such a wealth of resources. The coaches, which we'll talk more about later, these were volunteer coaches who were working directly with the nursing homes. These were all people who've been very experienced in the nursing home industry. So they bring such a depth of resources and knowledge to working with the nursing home teams. We had an evaluation partner, the LTSS Center, and Molly will be talking about the importance of the evaluation portion of this project and talk about the outcomes and our lessons learned. Our big rock stars were our nursing home teams. They dedicated the time to be a part of this effort because this wasn't a minimal ask, especially our program champions who had to do that internal coordination. They did a lot of work for us on the nursing home end to help coordinate. So this was our program team, and this is the all teach, all learn philosophy. We all learned from each other. Okay. Next slide. If I'm counting correctly, leadership. I haven't messed up yet. Okay, the leadership education was one of our three components. And so what we did is we used those national education experts and adapted 9 short virtual modules from Leading Age's Nurse Lead Leadership Development Program. And the sessions were 30 minutes. We heard loud and clear from the nursing homes, keep it short. We don't have time. If you're asking for direct care team members, we don't have time for long sessions. So the leadership education sessions were 30 minutes each. They were presented weekly for 9 consecutive weeks in the fall of 2024. And these weren't abstract leadership lectures. They focused on immediately usable skills, so it felt accessible to the people attending. It was communication, managing conflict, coaching, critical thinking, diversity, everything that is effective and important for everybody at any level. If you are a CNA working with the team, if you're a nurse, if you work with dietary, all of those skills are accessible and important. It was inclusive education, both clinical and non-clinical staff participated. And then following the lesson, they were further explained and the learning was reinforced by the coaches during debrief sessions that followed each education session. So now I'm going to transition to Chrissy, who was the program champion at, we're not quite there yet. That's going to be Molly, who's going to follow Chrissy. So Chrissy's going to be next. She's the program champion at our Fontainebleau Nursing Center. And so she can give you the real nursing home perspective on how this worked. I gave you the theoretical, so she'll give you the practical. And then we'll go to Molly, who'll talk about the evaluation portion.
Hello, I'm Chrissy. I'm the nurse educator at Fountain Blue Health and Rehabilitation Center in Livonia. So, when I was pulled into the group, the issues that I wanted to correct within my building were the increases in hospitalizations and as well as the UTIs that we had within our building leading to sepsis. The information that I gathered from this group allowed me to create better learning tools for my staff as well as my management. I also was able to invest in their leadership skills. We took our stipend specifically and it put more into our classroom. We wanted to create more real life experiences for our nurses to enhance their critical thinking skills to decrease our hospitalization. In the beginning of our project, our hospitalization was maybe about 60%. I would check it every 3 months to see what they were sending out patients for. I would take a deep dive into those illnesses. I would educate my staff on those with both real life scenarios as well as written education also and get them more comfortable with it. And now our hospitalization is about 22% for every 3 months. With our UTI section, we did a deep dive into hand washing, making sure that they understood how to maintain Foley's. We also put some of our stipend into that as well to make sure that they were able to insert Foley's correctly. And we did some more education on how they're passed through in the facility. This is where my coach came in handy because sometimes the issues with the hospital versus the nursing home wasn't as realistic as they look on paper. So we were able to tell them what that looks like as far as the turnaround, because sometimes they want them to start antibiotics within a 24 period, but that's not always realistic in a nursing home setting. So when we combined with our coaches, we were able to get some real life experience going on, and our UTI rates are down now. We used to have about 3 or 4 per month, and we've been having 1 to 0 as of recently. So this has turned our building around tremendously. This is something that we started for 18 months, but these are still practices that we practice today within our facility. My hardest challenge in the program was just making sure that all of my staff were available every Tuesday. But they did utilize the recording videos also. And that was my overall experience. All right, Molly.
Thank you, Chrissy. You
Mhm.
can go to the next slide, please. Great. So we've heard about the very conscious development of the Michigan team and of the trainings and also of the great insights from Chrissy. And what our team at Leading Age was tasked with was really on a larger scale, evaluating what are the positives and what are some of the challenges of this leadership training. So we did a mixed methods evaluation. First, we distributed online surveys before and after the training to get a sense of participants' knowledge levels pre and post intervention. And we wanted to get a range of responses across the nursing home teams. We asked questions about participants' understanding of topics that were covered in the training. So these are, inclusive of coaching, critical thinking, communication. And the post-training survey asked additional questions about how satisfied were participants with these training sessions. We also conducted 8 online interviews with staff and coaches across the 4 nursing homes that participated in the training to get an even better sense of their experience. Next slide, please. Here you can see the results from the knowledge assessment. So scores at baseline, this is before the training, are shown in blue, and scores at follow-up after the training are shown in green. So across both surveys, knowledge was very high. Even before going through any training, participants got on average 86% of the questions right, and after the training, this increased to 90%. Participants had the largest increase in knowledge scores on questions related to communication, with the average score jumping from 71% pre-training to 85% post-training. Next slide, please. Participants were generally very satisfied with the leadership training. 92% rated the training as either excellent or very good, with the remaining 8% rating the training as good. Next slide. We knew from the survey that participants were highly satisfied with the training, but we wanted to conduct individual interviews to let us dig a little deeper into how exactly these trainings were benefiting participants and how it was being applied in daily work. One benefit centered around the value that the coaches brought to the project. So coaches were embedded in nursing homes not to criticize, but to listen, provide resources, and support staff, which helped foster trust among the nursing home teams. So this was actually a quote from a coach and about their perspective of coming into a nursing home. As coaches, not coming in with this authoritative, we know best type of mentality. We just want to listen and we want to help you achieve your goals. We're not trying to find anything wrong. We're just trying to pour in resources. Participants also brought up the way that the leadership training created opportunities to encourage aides through reinforcing existing behavior. The training covered a lot of the stuff aides are already doing. Everyone looks at critical thinking as a big term. The training gave us a little something to chat about, and they were realizing, hey, you know what we do? Critically think every day. Next slide, please. So we heard this from Chrissy a moment ago, but a major challenge we heard across multiple interviews was ensuring that staff consistently attended trainings and that the material was circulated to a larger group within the nursing home, not just a small group that would attend the trainings. Other challenges included getting buy-in and support from upper management to implement the training material, and the volume and complexity of the material made it hard for some to digest within the time frame. So as Nancy had said, it was important that these trainings were short, but then the flip side to that is, having a lot of information and sometimes complex topics within a 30-minute time frame. Next slide, please. We asked participants what they would recommend to improve or maintain the quality of these trainings. Participants felt it was important to choose a program champion who has boots on the ground in the nursing home, such as a nurse manager. They also felt that because of staff's time constraints, having flexible options for training delivery and supplemental material like implementation guides, information sheets, or slide decks ahead of time would be helpful. So I will go ahead and hand it over to Nancy again to discuss the QAPI training, and I will see everyone again soon for that evaluation section.
Thanks, Molly.
Thank you. Okay, now we're to the QAPI and performance improvement projects portion of the grant. And that started in January of 25. So the leadership education started in September of 24. And we kicked off 25 talking all things QAPI. Everybody's favorite way to start the year. It began with each nursing home doing a self-assessment to identify their QAPI strengths, gaps, and opportunities. We were challenged to find a meaningful nursing home QAPI self-assessment tool. So in partnership with Superior Health, our QIO partner, we developed one. And then we used their feedback from their self-assessments to develop 4 short QAPI education modules. And those were also co-designed with Superior Health. So in April of 25, these focused QAPI education sessions were provided. We talked about using existing data, applying PDSA cycles, operationalizing QAPI, and we mimicked our leadership education. These were presented in 30-minute segments, Tuesdays again, because that was the day that was designated to be the best for them. And they were presented consecutively over 4 weeks. And then the coaches came right back in after each session to work with the nursing home teams, answer any questions, validate any information. It was really hands-on, multidisciplinary teams that led this work. Then, after the QAPI education, each nursing home was tasked with identifying one meaningful performance improvement project that was focused enough that it could be done over a 4 or 5 month period using their own data and their own priorities. And that really, the coaches really dove in and helped the nursing homes kind of hone down something that was going to be achievable over that 4 month period. So education was in April. The performance improvement projects were chosen and finalized in May. And then the nursing homes were off and running doing their performance improvement projects with the support of their coaches. We had monthly all team meetings. Any way we could deliver support and additional education or answer any questions for the nursing home teams, the whole project team that you saw before was there for that. So I'm going to hop this over to Chrissy to talk about how what they learned, I hear you're still using, Chrissy. So please
Yes,
share.
ma'am.
And then it'll go back to Molly.
So one of the things when we first started, she spoke to the 8 resources and things that we touched on in our 30-minute sessions. One of the things that stuck out to me most was how to dissect and create a root cause analysis, so that we're not just so quick to jump to it. So as I mentioned, one of the things that we were trying to cut down on were the UTIs. So we really did a deep dive into what patients were having them, what part of the facility they were in, did they have any pre-existing conditions, did the patients have a Foley? It just normalized us asking those 5 whys every time we were presented with something, no matter how deep it was, and it gave us a way better understanding. And also, it taught us how to look for things outside of a UTI, like maybe sometimes it's just the beginning of delirium and things like that. So we didn't have as many issues with abusing antibiotics in our facility as well. Yeah, that was one of the best parts for me.
Awesome. Molly, you want to talk about our evaluation piece?
I think we need to unmute Molly. There you go.
Okay, great. I think you can go maybe to the next slide, maybe a couple. Yeah, maybe. Perfect. Thank you. So to evaluate the benefits and challenges of participating in the QAPI training, we conducted 8 online interviews with coaches and staff across the 4 participating nursing homes. Next slide. And participants expressed that the QAPI training helped empower staff across departments to problem solve and make changes that they wish to see. Participants said that this kind of autonomy and empowerment can have implications for reducing turnover. So one quote from a participant: I think that giving a voice to the staff that identify problems and then giving them the tools to improve what they may have problems with, I think that's so important. Sometimes people leave jobs because they get frustrated when things don't change or when things don't improve. But when you empower the staff, they have these evidence-based steps and approaches to getting the change they want to see. Next slide, please. Another benefit, and this was really with regards to the PIPs, participants saw improved quality of care and quality of life among residents. These examples here reference decreases in UTIs, wound infections, and IV infections, as well as an increase in residents' leisure activities. Another team saw a decrease in readmissions, and I know Chrissy could probably talk much more about this, but these were some of the main findings that we heard in the interviews. Next slide, please. Similar to the leadership training, the main challenges were limited staff attendance and the volume and complexity of the training material. One participant said, it's a lot of content, and to try to get as much of it into a 30-minute session, you really don't get the depth of QAPI. And this participant and others suggested that in order to fully grasp the QAPI principles, an extended training or a greater number of shorter trainings would be beneficial. Next slide, please. Other recommendations included offering more opportunities for staff to practice implementing what they've learned, disseminating information about current QAPI projects to residents and families, and taking the time to choose meaningful PIPs. When asked about selecting a PIP, one coach indicated that I think the most important part of that was they picked something that was meaningful for them. Once they picked what issues they wanted to address, we then were able to tailor our feedback specifically to the issues that they had identified, making it very personal and meaningful for the facility.
Back to me.
Great.
Okay,
Nancy, before
Yeah.
you jump into this section, just
Mhm.
there's some chat about for-profit and not-for-profit. I said we had both.
We have both.
And the number of residents. So Chrissy said 108 roughly at Fontainebleau. I couldn't remember for the other 3 nursing homes. I thought they were all around 100, give or take.
The number of beds ranged between right about 100 up to a high of 210.
Thank you. Okay, onward with coaching. Thank you.
All right. Coaching was so important in this. We really believed that coaching was foundational. This wasn't supplemental. It was a key part of this project. Each nursing home, as I said earlier, was paired with 2 volunteer coaches, and we chose 2 intentionally. It provided continuity, shared learning. People came with different experience, different backgrounds. And in all honesty, this was an 18-month project that these volunteer coaches were putting quite a bit of time with. And we wanted the ability for life to happen. People needed to be able to go on vacation or have other challenges. Everybody had day jobs. This wasn't anybody's sole mission. So that's why we paired coaches. So if somebody needed to be off, somebody else could step in. And that worked really well. I'm glad we did that at the beginning. We were really intentional with that because the coaches were so hands-on. They conducted regular check-ins with their nursing home teams. They reinforced the concept between the sessions. They helped the teams navigate real challenges and maintain the momentum. The coaches were sometimes the phone a friend when things were going wrong and they didn't quite know a way out. I think all of us as coaches had gotten an occasional text or call. Hey, can you give me a call? We have something and we really would love to pick your brain around it. And the reason that relationship developed was because the coaches were really intentional about creating psychological safety. People knew that they could reach out to the coach. The coach wasn't from a regulatory body. They weren't from leadership at the nursing home. You could confess something that was going not quite right, and this person was just there to help you through it. They weren't going to tell anybody about it. It was so essential. And we went into it thinking education without the reinforcement likely wouldn't translate to sustained success. And the coaches, they were the ones that bridged that gap and gave the reinforcement and support and allowed these teams to really flourish. Next slide, please. I love this slide. This is so cool. Okay, this is our Fontainebleau team. And you will see Chrissy, the program champion, and Michelle, the coach. They got to work together, and they are going to talk now a little bit about how they set up that relationship, that coaching relationship, to be really successful throughout this project. So I'm going to hand it off to Michelle and Chrissy to talk about that.
Great.
Hi there, everybody. As you can see, there's a festive love that's going back and forth in the chat. Okay. And I have to say, I was really blessed, to be able to work with Fontainebleau staff and Chrissy. And I'll just say from my perspective that I think why it worked. One of the things that we did right away, and Belinda's in this picture too. She was the coach that also worked with me is that we met with Chrissy and her team in August before anything started. We thought it was very important to take some time, sit down, talk about, where did I come from? Where did she come from? Belinda, just have a really easy conversation. And I knew right from the beginning, oh my God, this is like divine intervention. Okay, this is going to work. Then we decided that when we were going to the kickoff day, as you can see, we decorated the room, her education room. Okay, we did, we put tablecloths, we put flowers in there, we had treats in there, we had balloons in there, and then we brought everybody a journal, and it had a lot of beautiful reflections in it. And just to let the staff know, this is your journal. You can use it for whatever you want. You could also journal your journey as we go through this. So I'm going to hand it off now. And I want to tell you something else that was really important, Chrissy, and maybe I never mentioned this to you, and I'm sorry, but Chrissy always went one step forward too. And that's why I loved working with her and her team. And like she said, she was always trying to corral the team, like calling, where are you? You're supposed to come down here now. But I loved her team too, because they were very conscious about leaving the residents. They were very sensitive to that. So what Chrissy did, there's a companion guide that came along with the nurse lead program, and Chrissy was always one step ahead. She was looking at the companion guide. What can I do in this 30-minute session after we have, our interactive session? What could I do with the team? And that really helped solidify everything. So I'll let you go ahead, Chrissy.
I just want to speak to the importance of a coach. I feel like she made it a lot easier because we would discuss everything on Zoom and we were talking and everything, but I had this additional resource after everything. We would get together, we would break everything down. And like I said in the chat, I would email, I would text, I would call. I cannot tell you how many times we've both spoke in the airport. Wherever we were, we would always get together with each other. But she gave me additional resources, and it got to the point where we were speaking far beyond this course. I would have situations happening in a facility, and I'm like, Michelle, what do I do? Because I know this and I know that, but give me your NP experience. And I don't know if everybody's coach was an NP. I use that to my advantage as well, because it gave me just that extra push, because I'm like, okay, well, if Michelle told me this, I'm going to call the hospital back and I'm going to utilize that. So she also gave a lot of information as far as sepsis screening, because she let me know, well, if they do go to the hospital, this is what's going to happen. So let's just try to do this here. So I use my coach for everything, and I will use my coach forever.
Thank you. She's so sweet, and I send her things off and on. I want to tell everybody too. One of the things that we discussed when we first met, and Chrissy also came up with this. Why don't we create a group text? So she says, "Oh, I know how to do that." And I said, "Of course you do, because you're young." So she created a group text, and we would text each other on Monday. And she told us what time, because she always had her management meeting. So we would text each other every Monday just to check in. And I think that's what really, really helped too.
All right. I think Molly's going to hop in for the next slide, and then you're back with me.
Great. So just to summarize some of the key findings from our evaluation, and I will say everything I've talked about today is very high level, but we do have an over 30-page evaluation report that if people are interested, I'm sure we'd love to get, into your hands. So I don't know if it's up on the Moving Forward site or if we can just get it to you individually, but we're happy to share. So one takeaway, the value of coaches. Coaches took on less of a traditional teaching role and more of one focused on guiding, nurturing, and active listening. And, from Michelle and Chrissy, you've sort of heard it all there. They provided hands-on support, including one-on-one mentoring, help with data analysis, process improvement, and project logistics. And among participants, there was high satisfaction with both leadership and QAPI training. So one participant said, I cannot say enough good things about this project. It has given me the confidence and the validation that I am on the right path to becoming an amazing leader. Next, increase knowledge of and confidence in leadership and QAPI skills, and improve teamwork and problem solving. So participants noted that staff across departments became more confident speaking up about resident issues. The trainings gave staff tools to not only observe a problem in the nursing home, but really take action to remedy it. So another quote that sort of highlights this interdisciplinary benefit. Not only CNAs have benefited, but the whole building. I mean, you're looking at, your maintenance people and your occupational therapy people and everybody. We're all looking around to see what could be improved. So with that, I will hand it back to Nancy to talk about some practical takeaways for other nursing homes to use.
Thanks, Molly. Next slide, please, Emily. Thank you. So some of our key lessons and takeaways were partnering leadership and QAPI is stronger than either of them alone. And inclusive teams really drove our engagement, having it not just clinical, not just department heads, but really direct care workers are new emerging leaders. Nursing homes need new leadership. And so this is how to invest in them. Coaching helps sustain our change. And the model is adaptable and scalable in that you can use the pieces that are meaningful for the needs for your nursing home. And in a little minute, I'll tell you how to get to those. Next slide, please, Emily. Okay, why this model matters. It improves resident safety, quality of life, staff satisfaction, regulatory readiness, organizational resilience, understanding QAPI, and understanding that the entire team of the nursing home is responsible for QAPI instead of just the committee that meets once a month in a meeting and nobody really knows what they're doing. The fact that you could go up to a random CNA on the floor and ask them what QAPI projects were being done in their area, and they could tell you about it. They could identify issues and bring them to the QAPI committee. And it really has lasting impact, which was honestly more than I hoped for. So I am so grateful that it has that.
I want to
One,
speak to the fact that letting
mhm.
everybody in your building know your QAPI, because as I mentioned, one of the issues we had as far as QAPI was UTIs, and even our maintenance director offers our patients waters now as they're rounding around. If they come in the room and they fix something, they're asking, would you like water? Do you need anything? Because the entire building has to be on board when you're working with your QAPI.
Thanks, Chrissy. And so true. That was our goal. And so it feels so good to hear you say that and validate that. One unexpected and powerful extension of this work was around emergency preparedness. Michelle mentioned it briefly at the beginning, and it evolved through the state team that she was talking about, but it became part of this quality effort, emergency preparedness. So next slide, please, Emily. And I'm going to let Michelle give you just a brief synopsis of emergency preparedness.
Thank you. As you can see, all these beautiful people right here, and Chrissy's like right in the middle. It was so funny. Chrissy showed up at this training exercise. She goes, "Oh my goodness, you're like everywhere." It was so cute. So just as mentioned earlier, the Michigan State team, we did host emergency preparedness exercises, and it was completely independent of this grant. But what we thought, what a good way to do. Let's invite the nursing homes. It seemed to be natural and intentional component of the grant project to help them fully integrate their leadership skills into real world, like challenges around emergency preparedness. So what we did is we delivered a 2.5-hour in-person emergency preparedness training exercise at their nursing home. Chrissy actually came to the one that we had with the 7 nursing homes, but all the other 3 nursing homes, we went actually to their environment. And we really wanted them, we thought it would really help them harmonize their leadership skills. Communication, got to have good communication if something bad is going on. Critical thinking, I got to think out of the box. Managing conflict, things that are going on, and also working with their team. So this 2.5 exercise that we did unfolded, and throughout the exercises, the individuals, the leaders, in the nursing homes, and this was a lot of people in the nursing home. This wasn't just the team, that we were coaching. They invited a lot of people. So some of the the people that were there, and why don't you go to the next slide? There, it was anywhere between 8 to maybe 20 people that attended these sessions at the nursing home. It was actually leadership under pressure, and we used a cybersecurity incident. They had to assess their operational coordination. They had to assess their operational communication. Who were they going to lean out to? And they had to evaluate, did they have the resources and manage what was going on with their staffing and support the situation? So it really helped bridge that leadership theory we were talking about into an operational reality. So we concluded the exercise with the hot wash. What did we learn? What worked? Where do we need to improve? It really solidified relationships also with the emergency management team in their area. And most importantly, it reinforced why this work fits squarely within the goals of the grant, because it really strengthened leadership capacity in a different way to really protect the residents and the staffs where it matters most.
Awesome.
This was great. And one of the things that they talked about in the emergency preparedness was a cyber attack. And maybe about 6 months later, Optalis was under a cyber attack.
Wow, that was,
Yes.
and
it went smoothly.
Yeah,
Everybody
there
knew
you
what to
go.
do.
And it's,
Thank you.
emergency preparedness is one of those things that nobody thinks about until the emergencies happen. So this is a good example of doing the work ahead of time, put you
Yes.
guys in a better position. So, well, I'm gonna move us into discussion mode here, if that's okay with all the speakers, if we've wrapped up. And Nancy, do you want to say anything else about
Just
sustainability?
one more super fast, I promise. I won't run over. We built sustainability in. So we developed an open access QAPI workbook and tools resource from what we presented with our nursing home teams. It is going to be hosted on the Moving Forward Coalition website late March, mid-April. So keep looking for it, but it is free and open access. Please jump in and use it. It's got the slide decks, it's got the education, it's got all the forms, it's got that nursing home self-assessment tool that we developed. So please. And the nurse leadership modules that are housed on the Leading Age Learning Hub have been updated based on the feedback we got from the nursing home teams and the coaches. Now I'm done, Al.
All right. And we had some chat about Nurse Lead too, and said the same thing. They're updating them now. So thanks for all that. Well, many thanks to all of the speakers and the teams. As you can tell, this is a tightly woven group with lots of positive energy and lots of outcomes to show for it. And many thanks to Molly. And we also have Verena Cimarelli on this call from LTSS, helping us so much with the evaluation of the program. So we have 5 whole minutes left. So I think we can, this is a great ending slide. But Emily, if you want, we can take the slides down now. And if you've joined, you're probably muted. And if you just ask to unmute, we will unmute you and let you ask a question or make a point. So feel free. We'd love to hear from anybody. Also, Jane Carmody's on the call. Of course, she and I are, 2 offices away from each other here. But Jane, I don't know if you want to add anything hearing about this project in particular.
Oh, there you go. You muted me. Wow. That's what I'm going to say. It was wonderful. And of course, Alice, I'm thinking, okay, now where can we spread this? Where can we take this? Michigan, praise for you. Thanks to our funding friends in Michigan, because this was such great work. Saw some notes about incentive, and what about the incentive of doing providing better care and better leadership for your nursing home. But Nancy, I was thinking about Nancy Zients and the work she's doing teaching nursing. I mean, it just all works together, Alice, and I'm so excited that I got to come today and hear about it. And congratulations, and thank you so much. And of course, my big fan of Michelle Macio, who has made a difference in whatever she does. And so, and Chrissy, you are amazing. Oh my goodness, and
Thank
everybody
you.
else that talked. But thank you so much. What a great program and a great impact to come.
Thank you, Jane. And, this is truly going to spread nationally. We very much hope people will use the resources. And again, want to recognize Leading Age. I know Natasha Bryant was on this call, and she's been leading the work with Leading Age and with the Nurse Lead program. There's other leadership programs too. We would want to say that it's not the only one. And, any way that there are free or low cost resources that are good resources, evidence-based, we encourage people to use those. Same thing with QAPI. We had tremendous partnership from Superior Health Quality Alliance, which is the QIO that covers Michigan and other states. And they helped a lot with the QAPI material. So we want to certainly acknowledge them as well. What other, and I see we have Carolyn Caston, a former iPro, also a QIO person who's working with us now on the call. As I mentioned, we have ombudsmen on this call. We have residents, we have legislators, we have advocates. So please ask to unmute if you have any questions for the team here. We'd love to hear from any and all of you. We have Nancy Tutors on the call. She leads NADANA, which is national work with lots of state chapters with directors of nursing. That's a great group to think about these tools because, again, it's people who are leading clinical teams in nursing homes. So Nance, we're glad you're on. And yes, we will send the slides and the recording out to everybody who registered. What else? What did we not talk about that you might be interested in?
Someone
Patty,
put in the chat.
So glad you're here. Yeah. Patty's our colleague out on Martha's Vineyard, and she's been on so many of these calls, and she's been doing great work out there to try to, again, promote age-friendly communities and leadership in a lot of this. So thanks for being on, Patty. I'm sorry, Michelle, what were you going to say?
Oh, no, it's okay. Someone asked about contact information. I said, I believe it's on the title slide, and Emily just put in, yes, we included our emails on there.
Yep. And please do reach out to us because we learn so much from you, all the people on this call. That's how the Moving Forward Coalition and these programs have really continued to move ahead. And so we really do value that. Any final comments from any of the speakers? And Jennifer and Emily, everybody good? We really appreciate everybody joining these calls, and we have some upcoming calls in the works in the planning phases, and we are grateful for everything you all are doing every single day. So we will look forward to seeing you on some of our next calls, and thank you all very much. Thanks to all our speakers and our friends. Take care. Bye.
Thank you, everybody.
Thank you.
Chrissy, talk to you soon.